In this video, we shall explore the causes of pain after gallbladder removal surgery that persists for some months. This is very disappointing for the patient, who quite rightly expect to be rid of the pain once the gallbladder is removed. So let's look at this cartoon. So the liver produces bile that comes down these two tubes into the gallbladder over here. And the gallbladder has stones, and these stones cause pain, which typically occurs after a meal, especially if the patient has had fatty food. And once the gallbladder is removed with surgery, then really this pain should not occur. So what are the reasons? In the main, gallbladders could be silent and the cause of the pain was different, so the diagnosis was not right. Or there were two existing causes of pain, so one part of it which has been treated, or something has happened during surgery which has given rise to this chronic pain. 1 in 10 patients may suffer pain, so the number is not small. So let's look into these causes. Firstly is the retained stone. What does that mean? It means that although the gallbladder has been removed, stones may get left behind over here in the tube that connects the gallbladder to the bile tube, or in the main bile tube itself. And these retained stones can cause quite significant symptoms even after gallbladder removal. Peptic ulcer. So this is the gullet, this is the stomach. And typically an ulcer in the stomach or in the small bowel can give rise to symptoms in the upper abdomen with the pain radiating through to the back. Gastritis and reflux. Inflammation of the lining of the stomach will give rise to pain, as would acid reflux. Typically the pain from the stomach is in the pit of the stomach and radiates to the left side of the upper abdomen. Irritable bowel may be a cause, where patients get spasmodic pain in the abdomen. It can be on the right side. It is associated with a change in bowel habit. And patients may at times have diarrhea or pass small pellety stool. Typically the symptoms are worse when the patients are stressed. Sometimes the pain may not be related to the stomach, the gallbladder and the bile tube, but to the pancreas, which is a gland behind the stomach. So patients may be prone to pancreatitis, or they may already have developed chronic pancreatitis, which is severe pain, again in the pit of the stomach that radiates to the back. In a very small number of patients, a condition may exist called Sphincter of Rd Dysfunction. What does that mean? At the bottom end of the bile tube and of the pancreas tube is a muscular sphincter, prone to a problem with this sphincter and how it behaves. The pain that this condition causes is very similar to biliary type pain, and it may only become more evident once the gallbladder is removed. This requires specialist care and attention. What about bile duct injury? So this obviously means that in the performance of the operation itself, there was an issue and there might have been an inadvertent injury to the main bile tube itself or to one of its main branches, resulting in a stricture of the bile tube and chronic pain. This again is a serious condition that generally requires another operation to fix. Issues in the chest wall itself, especially at the intersection of the rib and the cartilage. There might be inflammation called costochondritis, for which there are many reasons. Trauma is one of those, and this is usually mistaken for gallstone related trouble. So this is not a complete list, but the likely causes of persistent pain after gallbladder removal. Such patients ought to be seen by a specialist such as a gastroenterologist, and typically blood tests such as liver function tests, an MRI scan called MRCP to assess for remnant stones and the integrity of the bile tube, as well as pancreas is performed. Upper GI endoscopy assessing the stomach and the duodenum is typically performed, and specialist endoscopy such as ERCP is at times deployed depending on the situation. That it is best to be seen by a specialist with an interest in this area, who will then take a detailed history and direct the investigations appropriately. I hope you have found this of interest. If there are any comments, please do share.